Earlier this week, Obesity Canada published an updated guideline for managing obesity in children. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington, Dufferin Guelph. Thanks as always for your time.
Oh, thank you for having me.
So this new approach recommends focusing on things like quality of life and mental health, as well as medications. This is opposed to just focusing on the number on the scale. So I just want to get your take first on these new guidelines.
Yeah, well, I think they actually introduced some really important sort of information. Like, this is a really complex disease. It is not a simple making choices or bad choices to become obese. It also points out this is a very highly stigmatized chronic disease, which has a tendency over the course of an individual's lifetime to relapse, meaning you may improve, but you may also fall back into the category of obesity. And it's really pointing out that when you look at obesity in children, that there are many factors at play. Well, there's all the treatment factors, but there's also the environmental factors, the social factors, not just the behavioral, the cultural, or the family factors, and that the child is part of a broader system, and therefore we need to approach it with a much more broader approach to say that it isn't just about bad choices, and it isn't just about the way the child looks, but we really have to think about their longer term health benefits to this child.
And in saying that, do you think these guidelines will change kind of how people understand and I guess think about obesity in general?
Well, I think it actually helps us to start asking the right questions about childhood obesity. What are the underlying factors that are occurring? And we're actually seeing more and more obesity. So where do we see some of the other behaviors, such as the environmental influences? Where are the parks, the neighborhoods, the sidewalks? What are those other screen time, for example? What are those cultural influences that are making it difficult for people who are in families, children in particular, to actually live those lifestyles, make those choices, those good choices that will actually improve obesity? It also gives us some permission now to look at things like medications and surgical options in older children to try and change the needle, because we do know that if we look at children who are obese, if you are obese and you're between the ages of 7 and 11, 50% of those children go on to be obese adolescents. And then adolescents who are obese between the ages of 12 and 18, 80% of them go on to be obese adults. And that has highly stigmatizing lots of, whether it's mental health or physical health concerns. So this is really an important topic.
So when it comes to advice for parents and caregivers, what type of language should they be using to help shape the way children not only think of themselves, but how they are around food as well?
Now, really important question, because we really have to steer it away from what you look like to all the other benefits, because it's not about that. And often that isn't an adequate motivator, especially for some children. Being your appearance should not be what's driving this. But as I said, it's highly stigmatizing. So mental health issues are also some of the improvements that we can see. Some of the, children can also get high blood pressure, right? Can have some of the consequences of diabetes, for example, of being obese. So it's looking at what are those things in a family that we can concentrate on, things that are a benefit to them, that they value, that those are the kind of conversations, and definitely not about the blame and shame for the child, who often is living in this really complex environment that's contributing to many of the factors that are resulting in obesity.
Well, it's certainly a timely topic and a great one to have. Thank you for having it with us, Dr. Mercer. Dr. Nicola Mercer is the Medical Officer of Health in Wellington, Dufferin Guelph. Thanks as always.
Oh, and thank you.